Good afternoon, welcome back to my no-name channel. I'm Bruce and this is another Bali COVID-19 update for August 4th, 2021. I had to think about the date. And this is the first of the twice a week videos. And first let's start off with the numbers. So what about the numbers? Well, good news and bad news. The good news is nationally the numbers are going down. Take a look at this chart here. You see that nice dip there. So that's positive. The bad news, we're still up. And you take a look here at what's happening with Bali, and you can see the number of new cases. We're still up there. The number of deaths. So what about the numbers for Indonesia as a whole? 33,900 new cases. Okay, and testing, 151,700 tests were done on August 3rd, 22.3% positive. That's not good. What about Bali? Well, Bali had 3,075,169 first doses, 939,555 second doses. We're up to 22% of the population with second doses. That's great. 38,743 tested yesterday. I'd given doses given yesterday, so really good. What about the numbers? Well, our 7-day average is still going up. It's 1,259. And the 7-day average for deaths going up again, 36. And numbers for yesterday were new cases, 1,408. And just before I filmed this, I could hear the sirens going from the ambulances, and that's becoming a common thing, unfortunately. And I was talking to one of my kids yesterday down in Denpasar, and she said the same thing. You hear more and more sirens from ambulances. So 1,408 new cases, recoveries 937, deaths 38, and active cases 13,344. Okay, of the 1,408, all new cases are foreigners. All new cases are Indonesians, no foreigners. And 1,108 local transmissions, 291 cases domestic travelers, 9 cases from international travelers. And what about by regency? Denpasar 631, Badung 216, Buleleng 187, Tabanan 107, Gianyar 83, Jembrana 81, Klungkung 44, Karangasem 36, Bangli 20. Okay, so numbers for Bali, yeah, not encouraging. Not encouraging, and so I wouldn't expect anything to open up soon, but there's a story that just came out just this second. I don't have time because I want to get this done. I'm not feeling real well. I'm going to talk about this in a minute. I want to get this done and uploaded and then go and lay down for a while. The numbers, yeah, some good, some bad. Okay. Let's go into the question everybody had about what's happening in terms of restrictions. The big story everybody's been waiting for, that we wait for each week now, is what's happening with the PPKM 4 restrictions. And no, it is not a lockdown. People keep calling it a lockdown. It's hardly a lockdown. You can go where you want to. The streets in Singaraja full all the time. Restaurants are open, even if it's limited. Beaches apparently are open, as I showed last time. So this is not a lockdown. These are restrictions, and they're pretty loose restrictions. So last night, President Jokowi had another one of his weekly news broadcasts and announced what most people expected, that the restrictions would continue for another week up until August 9th. So we're going to go week by week into the indefinite future. And with August 17th coming up, well, who knows what's going to happen. As it is now, there's no annual traffic slowdown because we don't have groups of school children marching up and down the streets. And if you drive a lot, well, you're happy about that. And if you're not a big driver like I am, yeah, it's nice to see the kids out, even though most of my kids really didn't like that when they were at that stage, and my granddaughter doesn't like it either. What are the restrictions? Are there anything new this week? Well, from the president, things look pretty much the same. So, things look pretty much the same, yeah. The restrictions are pretty much the same old. And so, we're gonna continue on going week by week and see what happens probably into September. Although I don't know. As I said, August 17th is coming up. We'll see what's going to happen. There have been calls by some players in the tourism industry in Bali, and I'll cover this on Sunday, who want to open up now, despite the fact with high numbers, because we have CHSE going on, and that's great. But anecdotal evidence, and there's nothing here that's come out in the last couple of days talking about hospital capacity, but anecdotal evidence is that puskesmases are being overwhelmed in some parts of Bali with testing, and so that's not good. Should we open up? Well, I'll talk about that at the end. So vaccinations are ongoing, second doses, and so today in Buleleng, second doses were going around. Kampung Bugis had their second dose, and we weren't sure where the second dose was going to be. We went to where we got the first dose. The place is not where it was last time. We have to go to another place. This morning, nobody was there. Fortunately, a person that my wife knows who works for the Laura's office said, oh, the vaccinations are over at the Laura's office. And so we trekked over there, which was a bit of a walk. And fortunately, we were an hour early. We thought they would start at 8 o'clock because that's what it usually starts at, but they said 9 o'clock. But there are already people queued up. I got number 13. Turned out to be not an unlucky 13. And they took my papers and we went and sat in this room. It's like the badminton room. Very hot. And as we waited, the room began to fill up until there were over 100 people. I don't know how many actually, but I was talking to one guy whose number was 100, and he wasn't last. And so social distancing, you can see from the photo, nobody was social distancing. People were sitting right next to each other. They would come in, they would see a friend, and they would go over and sit right next to them. Chairs were packed together. So this is just one of the problems here. So I got my shot. How am I feeling? I'm not feeling real great. My arm's a little sore. I had a fever last night. I'm a little warm today, but yeah, not really much, 36.7. But muscle aches, and I'm really tired, and I have a headache. But the good news is I got my second dose, and the bad news is, as I said, the social distancing. In the last video, I left out a story about Indonesia having trouble meeting the target of 2 million vaccinations per day starting this month because of a shortage of vaccine. So here's a positive update, something positive on that story. And one of the reasons for doing 2 updates a week. Indonesia upbeat about securing COVID-19 vaccine supplies for August. So Sunday brought the good news that a shipment of 3.5 million doses of Moderna donated by the United States arrived in Indonesia. And a shipment of AstraZeneca from the UK arrived on Monday. So the Moderna is a ready-to-use vaccine with 3.5 million doses, and then there's 620,000 doses of AstraZeneca. And according to the Coordinating Minister for Human Development and Cultural Affairs, Muhajir Effendi, this is enough for Indonesia to get through August, meeting its target of 2 million doses. So far, Indonesia has received 8,160,000 doses of Moderna from the US, and the AstraZeneca vaccines coming from the UK, as I said, and the government will continue to receive more vaccine in the future, although up until now it's not been determined the number of vaccines or when we're going to receive it. But we are supposed to receive more AstraZeneca from the UK. Currently, Indonesia has received 178,357,880 doses of COVID-19 vaccine, of which 144,700,280 doses are bulk vaccines, which means that they need to be processed here, while 33,657,600 doses are in the form of finished vaccines. Overall, Indonesia has secured promises for 440 million doses of various vaccines that will arrive in Indonesia over several stages. And Effendi said that the vaccines are safe and halal, so people should not hesitate to be vaccinated. And as always, he concluded his statement with a reminder for the public to follow health protocols of wearing a mask, washing their hands, and maintaining social distance. And as you will see at the end of this, when I talk about my second dose vaccination today, and as I've often said, social distancing, not a concept here. And more on vaccine news. The Sinovac vaccine, arguably the least desirable of all the various vaccines widely available in Indonesia. And this is a study that comes from China. And according to the study, antibodies triggered by Sinovac's vaccine declined below a key threshold from around 6 months after a second dose for most recipients, although a third shot had a strong booster effect. And this is according to this lab study that has not been peer-reviewed yet. And the study looked at blood samples from healthy adults between the ages of 18 and 59. Participants received 2 doses, either between 2 weeks or 4 weeks apart, and only 16.9% of the 2 weeks, 35.2% of the 4 weeks still had neutralizing antibodies above what researchers regarded as detectable threshold level 6 months after the second shot. So researchers said it was unclear how the decrease in antibodies would affect this shot's effectiveness, since the scientists have yet to figure out precisely the threshold of antibody levels for a vaccine to be able to prevent the disease. In the short to medium term, ensuring more people complete the current 2-dose schedule of Coronavac should be the priority, the paper said. So there are questions worldwide about the Sinovac, and Indonesia and Thailand have already agreed to give a third shot from Moderna and Pfizer, respectively, for some people who are fully vaccinated with Sinovac, amid concerns over its effectiveness against the highly transmissible Delta variant. Turkey has already started giving a third dose from either Sinovac or Pfizer to some people who got Sinovac shots. As of the end of June, Sinovac has been delivered more than 1 billion doses, and it's a major vaccination tool in China, Brazil, Indonesia, and Chile. The study said that participants in some cohorts who received a third dose of the Sinovac shot about 6 months after the second shot showed a 3 to 5-fold increase in antibody levels after a further 28 days, compared with levels seen 4 weeks after the second shot. However, researchers cautioned that the study did not test the antibody's effect against more transmissible variants, read Delta, and that further research was needed to assess antibody duration after a third shot. So this is news that's going around the world about questioning the efficacy of the Sinovac and booster shots, and I talked about this I think last month already, going on in some places in I think the UAE. And this study was conducted by researchers at disease control authorities in Jiangsu province, China, the Sinovac and other Chinese institutions. And what about schools, right? I keep talking about schools. Well, take a listen to this segment. If the COVID-19 pandemic ends, Koster will continue the online teaching and learning method in Bali. According to the governor, the pandemic has made a revolution in the world of education inevitable. And what will this revolution consist of? Well, one will be a change in teaching and learning methods from the conventional to virtual or online learning. The governor said that he is going to continue online learning even when the pandemic ends. He's planning on using a hybrid approach, which is a combination of face-to-face learning and online learning. And by the way, this is not revolutionary. This has been going on all over the world since the pandemic started, except here. The governor said last Wednesday, during this pandemic, we've learned lessons. Learning can be done online. Learning can be done online. It doesn't have to be carried out in a conventional room. After this pandemic ends, we must continue to carry out online learning, so we will determine two hybrid methods, conventional and online. And what's the rationale for this switch? Well, the governor said more students can be accommodated in the state schools and there will be no need to create new classrooms or new schools. So we keep the same old schools with the same old classrooms. Saves money. Makes sense economically, I guess. The governor said he already has a scheme for this new revolutionary teaching and learning method. He said, I already have a scheme. Which lessons are face-to-face and which ones can be online. Because in an online way, one person can teach 150 SMK students. For example, a teacher of Indonesian language, history, Pancasila may be 70% online, 30% meet at school. For mathematics, physics, maybe 70% in face-to-face schools, 30% online. The governor plans to share his idea with Indonesia's Minister of Education and Culture, Nadia Makarim. This revolutionary plan to have this hybrid system is happening while all around the world, countries are struggling to get students back into the classroom. But that seems to be not a priority here. The hybrid method has been a stopgap measure, one the schools use only in order to keep some face-to-face online face-to-face learning going. Talking to friends of mine from around Asia who use this, Korea, Taiwan, China, Japan, none of them prefer it. Students, they don't prefer it either. It requires extra work for the teachers, extra work for the students, extra work for the parents. And the results have not yet been studied in order to see how effective it is. And it's not clear from what the government said what grade levels the governor's plan includes. Is it just going to be high schools? Is it going to be elementary schools? Is it going to be middle schools? So that's unclear. An article published in the Jakarta Post in March looked at hybrid learning as a transition from online to offline learning. The authors noted that the longer children learn at home, the greater the risk that they'll fall behind. Among the factors contributing to this loss, a loss of interest due to no direct interaction with teachers and peers, an inability to understand abstract ideas for younger students who are in a concrete operational stage according to Piaget's theory of cognitive development, because students need direct social experience and interaction. Difficulties for parents in helping their children understand the instructions for classroom assignments that come through WhatsApp, and that includes my wife and I. A lack of access to required technology. What about kids who come from poor families and don't have computers, don't have tablets, don't have broadband? How are they going to work in this new hybrid system? The authors of the Jakarta Post article noted that the absence of in-person interaction, or what I call face-to-face learning, is hindering the transfer of knowledge from teachers to students. And they said hybrid learning is an option that the government and teachers can consider as a transition to opening the schools. And in a study of Dutch students, learning lost due to school closures during the COVID-19 pandemic. The findings imply that students made little or no progress while learning from home and suggest losses even larger in countries with weaker infrastructure or longer school closures. School here has been closed since, last April? And our infrastructure, it's certainly not at the level of the Netherlands. Early data from online learning platforms suggest a drop in coursework completed and an increased dispersion of test scores. So survey evidence suggests that children spend considerably less time studying during lockdowns. So what do we need? Well, we need some studies that show that hybrid learning is effective, that online learning is effective. We need to look at the infrastructure. We need to learn at what grade, we need to look at what grade levels are going to be affected. And training for teachers. When Korea went into online learning, teachers were trained. Teachers were trained in Japan. Teachers were trained in China. Nobody has been trained here as far as I know. We need to go through training for not only teachers, but parents. There should be parental workshops to show how to do this, and that can take place on Zoom. It doesn't have to take place in person. It could be done on Zoom, or it could be done in an open area. There are a number of different ways to do this, but some training or socialization, as it's called here in Indonesia, needs to take part before we even attempt to change into a new mode of teaching and learning. There are a lot of questions here that need to be answered before we switch the way children are taught in Indonesia. Okay, time for the wrap up. So, this is my first mid-week update, and what do we got? Well, the numbers, as I said, some positives and some negatives. Good nationally, not good in terms of Bali. The real positive news is that we've got more vaccines coming, and there's a report that just came out that I'll talk about on Sunday with more vaccines coming. So the vaccination process is ongoing here and around the country, which is really important. So there's some reason to be optimistic this week, that with all the vaccinations going on, we will get to a point where they're going to really show up in the numbers. Beaches are open, restaurants are open, albeit restricted. Businesses open, also somewhat restricted. But out in the street, life goes on like usual. Mask wearing in the main areas, I still see people wearing masks in the main areas, but in the neighborhoods, forget it. Is Bali going to open up soon? Well, as I'm going to talk about on Sunday, there are people that in the Bali tourism business industry who want to open up right now, or want to open up in September. And part of the report that I'm going to talk about is the government saying that they're going to start opening things up gradually starting in September, assuming that the numbers continue to improve on a national basis. But restrictions still on who can come in. So Kitap, diplomatic, the B211s, no, still not going to come in now. People leaving, anecdotal evidence, there was nothing in the last few days about people leaving. Anecdotal evidence from YouTubers and influencers mentioning that they've been in places where there are less people than before the restrictions started. And so, yeah, I don't know. What do you see where you are? Do you see a lessening of foreigners around? So that's just about it. With the exception of, I was going to mention this before and I haven't done it. I get a couple of people who send me these comments that YouTube censors out, calling me a variety of names which I won't go into, because I'm for vaccinations and I'm for keeping Bali closed to tourism right now. I don't know what your story is, but you should know that using that kind of language is not going to get published. YouTube's not going to let it through, and I'm certainly not going to let it through. If you've got nothing better to do with your time, then send some emails into ether space, because that's where they end up. Yeah, go ahead. But it ain't gonna show up on my channel. Okay, so that's it. I'm a little warm and, as I said, a little sore. So that's it for today. Thanks for viewing. Take care. If you want to come in, hang in there. Who knows? Maybe we will open up in September. Be kind to someone today. Wear a mask. Social distance. See you next time.